Good afternoon, everyone. This time, my colleagues and me are going to talk about the specialty of obstetric gynecology. We will learn about the definition of some medical words in English, some relevant facts of the specialty, and often what is the difference between obstetric and gynecology. Um, all this as prelude to our final global village project. Gynecology versus obstetrics. Obstetrics is considered a special line that encompasses different fields, involving care during preconception, pregnancy, for immediately after delivery. And secondly, gynecology involves the care of women's health problems, such as reproductive disorders, social endometriosis, infertility, screening, treatment for vaginal infections. Many residents rotation include deep ultrasound, reproductive endocrinology, infertility, family planning, gynecology, surgeries, oncology, training in both OBM, GIM, and the doctor can choose between one or both. Um, Communication in the program for all professional or student of science, technology or communities, but specialized field. American systematically update the basic knowledge vocabulary that includes the instrument they use in the discipline consists uh, of Spanish, military, and other English. Well, uh, some words that we will use later are endometriosis is disorder in which the same type of tissue that lines of walls of the uterus grow outside of the uterus in the pelvic cavity or somewhere in the body. Amenorrhea, which is the absence of the woman's monthly menstrual periods. Gestational diabetes, which is a type of high blood sugar that affects pregnant women. Pelvic inflammatory diseases is an infection of the woman's reproductive organs, and other that we will explain as we advances in the presentation.
Hello, teacher and classmates. I am Hernan Felipe, Valencia. Let's talk a little about maternal mortality. Worldwide, approximately 303,000 women age years due to a pregnancy-related complication. 50% of the deaths are preventable if new technical and medication are used to antepartum, intrapartum, and postpartum care. The United Nations has set goals to reduce maternal mortality by spending money to improve delivery care, increase access to contraceptions, and increase prenatal care visits. Thanks to these types of interventions, it has been possible to reduce maternal mortality worldwide by 45% between 1990 and 2050. Most countries in the world have reported a decrease in mortality between 2000 and 2014. The United States, on the other hand, has shown an increase in maternal mortality, mainly in people of African descent. This increase is due to the greater number of women with maternal age greater than 35 years, chronic cardiovascular disease, and risk of violent trauma. The higher the investment in health, the lower the maternal mortality. Hello, teacher and class. The cause of maternal mortality. The most common cause are hemorrhage, sepsis, and eclampsia. Are the most common cause of preventable maternal mortality in both resource-rich and resource-poor countries. Postpartum hemorrhage remains the leading cause of maternal death worldwide, with approximately 140,000 deaths per year. In more developed countries, maternal mortality from cardiovascular cause is one the rate. This cause includes stroke hypertension, cardiomyopathy, rupture aneurysm, myocardia, infarction, and pulmonary embolism. This is attributed to the rising maternal obesity. Now, let's talk about improving maternal outcomes. In an effort to reduce maternal mortality, groups have been implemented that are in charge of recognizing and monitoring the risks of mothers, in addition to ensuring their well-being. Implementing protocols for the care of high-risk maternal complications, improving patients' safety. The quality of maternity hospital and outpatient clinic has also been improved to reduce morbidity and mortality in healthcare. A study found that the main cause of poor care during labor and delivery is poor communication, which is with the birth situation background assessment recommendation. Technique was implemented to improve these aspects, and it is about one, situation, what is happening with the patients. Two, history, what is the medical history. Three, evolution. What do you think is the problem? Four, recommendation. What will it do to correct it? It is important to educate healthcare personnel and patients in areas where there is inadequate access to healthcare about abnormal vital signs and clinical symptoms. Severe heart, hypertension, like upper problem plane, to make a reference to a high level entity. That's all. Thank you.
Hi teacher, I'm Camila Rios Morenas. Continue with the proposed topic. We will talk about hypertensive disease with pregnancy, and especially preeclampsia, which are the main cases of peritoneal and vaginal morbidity and mortality. Preeclampsia is a state characterized by the presence of hypertension and proteinuria, which occurs when first time after the 20-week pregnancy, during childbirth or in the pregnant is also preeclampsia when there is hypertension in pregnancy and a severity criterion, even when there is no criteria demonstrated at first. Hyperclampsia causes serious health problems, which represents challenges for predictions, prevention, and treatment. Severe preeclampsia can develop in up to about 25% of preeclampsia cases. Globally, preeclampsia and eclampsia are responsible for approximately 40% of maternal deaths per year. Their disease can cause liver and kidney failure, disseminated intravascular coagulopathy, and central nervous system anomalies. This represents a challenge for the participants of the health system, as a kind we see represented in the clinical case present, where a patient who came to our clinical center with 29 weeks of pregnancy with dyspnea, manifested cyanosis, tachycardia, and epigastric pain. She developed complications associated with the severe preeclampsia and unfortunately ended with a fatal outcomes after 10 days of postpartum cesarean sections. Despite timely diagnosis and proper treatment. Thank you. Another important topic to know about is cervical cancer. Cervical cancer is a disease in which malignant cells play the tissues of the cervix. Human papillomavirus infection is the main risk factor for the cervical cancer, so this timely diagnosis is important. Our findings suggest that below a certain system for the treatment purpose has high prognosis for women with infertility and other carcinomas. Elimination of women with stage 2 to 1 life involvement and specification of patients with stage 3 CDCs improve the population of stage 4 survival. Since survival is very similar for patients with tumors confined to the endometrium with superficial myeloproliferation, recombination of the stage 1A and 1B provide a reduction in the number of separations in stage 1 without reduction in prognosis discrimination. Thanks, teacher.
Hi, welcome to our work. Our work is called Obstetric and Gynecology. We have 350,000 inhabitants. Our official language is Gynecology. Our government is totalitarian matriarchy, secular state. We have a religious freedom. Our traditions, we have the monthly both search examination, annual visit to gynecology, safe sex all time, healthy daily habitants, vaccination against HPV in childhood, prevention in sexually transmitted infections. We also have a few holidays. We are the International Breast Cancer Day on October 18th, World Cervical Cancer on March 26th, Obstetric and Gynecology Day, November 25th, World Menopause Day on October 18th. Bye.